Hey guys, so my name is Josh Rodriguez, and this is my Bureaucracy presentation on the California Department of Public Health. So let's get to it, man. Okay, so California Department of Public Health, or you could just call it CDPH for short, which I recommend. So it was created back in the 19th century. However, it was used to be called the State Board. So it was created around years between 1869 through 1870, but mainly 1870. So when it was called, before it was called the California Department of Public Health, it was mainly known for the State Board of Public Health. So kind of the same thing. So it was actually called that and Visual Statistics. And it was also stated in the article Inventory Records Department of Public Health. So the reason why it was created was because it was more of a response to develop public health needs of Californians, and it was also focusing to give a more arranged, effective, and dedicated approach to manage public health issues. So yeah. So second question. So what is the function of department or agency? So infectious disease control and prevention is one of the topics that we'll be talking about. So the CDPH duties are to prevent and control the growth of infectious diseases. For example, it states in the article about CDPH, so you got Zika virus, HIV, you got AIDS, hepatitis, tuberculosis, and all different types of diseases that are been working on to be preventing and being controlled so it won't spread. So the second one, so it will be food safety and environmental health. So what that is, what they do, they make sure the safety of food and bottled waters and manage environmental health issues. So you got the third one. So the third one is chronic disease prevention and health promotion. So the programs to decrease the frequency of chronic diseases. For instance, you got diabetes, cardiovascular disease, cancer, asthma, and obesity. So the fourth one would be emergency preparedness. So basically, emergency preparedness will be more about being prepared for something that can happen, and it'll be easier to call somebody so they can respond like that fast to public health emergencies. So be easier like that. So you got fifth one, so family health services. So in the article about CDPH, it explains the family health services that provide nutritional support and screening genetic diseases in newborns and as well as pregnant women. So then you got the last one, actually not the last one, the health equity. So health equity helps to work to decrease health disparities between vulnerable and unserved communities. Now you got the last one, so visual records and statistics. So what that means, it controls birth and death certificates and other types of virtual records. So third question, how does a department or agency meet this function? So the CDPH meets this function in different types of categories as well. So you got intersectional collaboration. So what they do, they're responsible for transportation, housing, education, and environmental protection. So the second one, health equity focus. So what is that? So what they do, they confront social determinants of health like economic status, educational attainments, and neighborhood characteristics. So the third one will be sustainable communities. So sustainable communities, it's more encourages policies that better air and water features, save natural resources, as well as growing access to reasonable housing. So you got the fourth one, chronic disease prevention. So chronic disease prevention, what they do is they merge health factors in transportation planning and the CDPH supporting physical activities and in order to help stop chronic infections, basically. So lastly, for that, we got the climate change mitigation. So for that last topic, however, since it does not only confront environmental health, but it also gives a co-benefits for chronic diseases prevention and in general public health. So fourth question, who is currently in charge of this agency? So who is charged in this agency? I'll tell you who it is. So the director that's currently in charge of this agency, his name is Dr. Thomas J. Argon. So he was there in that company around January 4th, 2021. And before he was part of the director system, he was a health officer for the city and county of San Francisco, and he went to Harvard Medical School and UC Berkeley, which is actually pretty impressive for that. So the fifth question, is this a cabinet level department or agency? Or if it's not, where does it fit in the cabinet level structure? So in this case, yes, this is a cabinet level agency. So because it plays a crucial role in establishing and directing health information systems throughout the whole COVID-19 pandemic. So during those times, so nevertheless, actually, CDPH formed a unique system for actual laboratory test results and directing the increase of electronic lab results as well during the pandemic. So the key points are the developments of disease-specific network, so then which is for the laboratory test results. You got COVID-19 reporting system, then the controlling of the development volume of COVID-19 results, controlling public health details and resources, and lastly, surveillance and public health information reportings. So this question, what are the requirements for getting a job in this department or agency? So the requirements it's pretty simple. So all you need to do is just go to the website of the CDPH or California Department of Public Health. Then after that, you got to make sure you got a degree in human resources, business administration, or something in that field, and then you also need to have that experience in that field so they can make sure to, have a lookout and try to get you. So after that, you got to do the application, a standard side application, and you also, once you're at those times when you're ready, like getting into that, you have to do an evaluation test. Either evaluation test or any type of test that's required to do in order to get into that field. And lastly, once you pass the test and you filled out the application and everything, they set you up with an interview on whatever positions are available, and from there you go. So 7th question, does a person have to be a United citizen to work in this department or agency? So in this case, you do not need to be a U.S. citizen to work in California Department of Public Health, because in the article of California Department of General Services, or for short DGS, they talk about how citizenship is not required to work in any state classifications, and the only thing you need to confirm their qualifications to be able to work in the U.S. and under the Immigration Reform Act and Control Act. So the last question. So in my opinion, this agency does meet the functions effectively because the CDPH, they actually made progress for achieving to protect and assist the health of Californians. Especially numerous programs have improved health resulted across the state, and the future of health focuses to improve and strengthen the public health resources, public health structures. But that concludes my presentation. Thank you for listening, and I hope you enjoyed it. Thank you.